we're going to start with the COVID-19 situation in South Korea. The number of new daily cases is still well in the hundreds of thousands, but the country has been on a downward trend for the past couple of days. Despite the weekend effect of fewer tests being conducted, authorities are still cautiously suggesting the country has possibly passed the peak in terms of Omicron.
Yet they remain on high alert with the rapid spread of the highly transmissible subvariant of Omicron, BA.2. For more on this, our reporter Choi Min-jung is here in the studio with us. Good morning, Min-jung.
Good morning.
So let's start with the local infections for today.
Mok-yeon cases have been dropping for the past couple of days, and today we're expecting it to drop to somewhere in the 200,000s. From midnight to 9 p.m. Sunday, South Korea saw close to 184,000 cases. We saw a drop of a whopping 126,000 cases from the same time the day before. The tally for this time period has been on a downward trend since hitting a record high of more than 300,000 cases 2 weeks ago. We usually tend to see fewer cases on Mondays as fewer people get tested for COVID-19 over the weekend. But we will have to wait and see if cases will remain on this downward trend later in the week. Health authorities have been saying that infections are declining overall after cautiously declaring that Omicron wave reached its peak around 2 weeks ago.
Okay, so it's a good sign that we seem to be on this downward trend now. However, looming in the background, there's this so-called stealth Omicron BA.2.
Right, Mark. We know so far that stealth Omicron, also known as BA.2 variant, poses the same level of threat to people's health as Omicron. But what's concerning is its infection rate. Stealth Omicron spreads 30% faster than Omicron, and it's already making up more than 40% of infections. Now, because of this, some experts predict that the current wave will last longer. And this has already been the case in Europe, where countries like Germany, France, and Italy have been seeing an uptick in infections driven by the BA.2 variant. Health authorities will be announcing details on the current spread of the subvariant later today, along with forecasts on the country's virus situation.
Now, Min-jung, a new COVID-19 oral pill, Lagevrio, has been available in South Korea since Saturday. So how did the rollout go?
Well, around 20,000 courses of the pill were distributed to designated hospitals and pharmacies on Saturday. And a pharmacy in Seoul received enough courses to treat 20 people, but said they hadn't received many prescriptions for Lagevrio yet. And this could be because Lagevrio is recommended as an alternative for COVID-19 patients who cannot take Paxlovid due to health issues. Lagevrio was shown to be around 30% effective against hospitalization and death, compared to 90% for Paxlovid. But experts still say it could treat those who have underlying diseases related to the liver or kidney. And the introduction of Lagevrio is expected to ease the shortage of COVID-19 oral treatments, as some 7,000 people are prescribed with medication each day. And to overcome the shortage, officials are planning to bring in a total of 184,000 courses of oral pills by the end of this month, and another 276,000 courses in April.
And starting this week, from Thursday, I believe, South Korea will permit COVID-19 vaccinations for children between the ages of 5 and 11. There are a number of parents here in South Korea who are skeptical about having their children take the shot, but how are parents in other countries reacting?
Right, Mark, as you said, vaccinations for children aged 5 to 11 will begin this Thursday, and there are debates over the safety of the vaccines for young kids. But there are countries that have already begun inoculating this age group much earlier than South Korea. The U.S. began administering shots from November last year, and the vaccination rate for children has surpassed 30%. It did start off slow, but has begun to pick up pace. The majority of the side effects that were reported were mild, including fever and a headache. According to the CDC, the vaccine is relatively less effective in preventing infections compared to other age groups, possibly because they are given smaller doses. But medical experts still recommend shots for children as they reduce hospitalization by 74%.
All right, Min-jung, thank you so much for your report. We'll talk to you again this week.
Thank you.